Astle, you're managing director of a care home in Nottingham. Did you feel under pressure to take people in from hospitals early on in the crisis who you may or may not have known had COVID? Part of the problem is the lack of testing at that early stage. And what do you feel about that early guidance up until the middle of March, that those in care homes were very unlikely to be infected?
Good morning. Early on, we didn't have the beds available to accept people from hospital. So the answer is no, we didn't feel pressured at that time. But once we'd had a number of deaths, and at the peak, we'd lost 13 of our family members. That's what we call our residents. It was a torrid time, very distressing. And financially, I felt pressured that we needed to take people in to fill those beds, to keep the home viable for the people that were living in the home and for our staff who need jobs so that they can keep a roof over their family's head. So initially not pressured, but certainly once we had vacancies, did feel pressured.
Mike Padgham, you are Managing Director of St Cecilia's, a care group that manages 4 care homes on the North Yorkshire coast. You've sadly lost 19 people over the pandemic period. 5 tested positive for COVID. Other cases may have been covered, but they haven't been able to say for sure. You're also chairman of the independent care group, representing all care providers in York and North Yorkshire. I mean, from the outside, this looks like an absolute scandal, frankly, where the government can pretend they made care homes a priority, but until April the 15th, there was actually specific guidance that hospitals didn't need to test anyone before they were sent back to care homes. And that has caused, I would argue, from what I'm looking at, the epidemic we're now seeing in care homes.
Yes, good morning, Piers. I think we do feel let down by government. I wouldn't just say this government, because social care and care homes have been ignored for maybe more than 2 decades. But getting to this pandemic, we did follow the advice early on by government that you quoted and Keir Starmer quoted. We were reassured. As time's gone on, we've had to make our own, take our own initiative, really, and plan and try and reduce the deaths as much as possible. But we've felt that we've been left out in the cold, and the government's only just woken up to it. And it's a big, big shame. And
from what you're gleaning from other people who run and own care homes, I mean, how big a sense of betrayal are people feeling, not just about the lack of testing, which continues to be an issue, but the lack of PPE, which so many care workers have complained about?
Well, it's a mess, really, and I think we feel we're fighting on 2 fronts. We're fighting the dreadful pandemic, but we're also fighting the government to get them to realise that still to this day, we still have PPE issues on the supply chain. We still have issues with testing, and a lot of the money that the government has given to local government hasn't found its way to many frontline providers across England. So that's devastating to them. As Anita mentioned, there is financial pressure on us too now as well.
Anita, what has been the situation with PPE where you are? Because, of course, if you're feeling financial pressure to take residents in, some of them who may be suffering from the virus, you're under pressure to do barrier nursing, of course, and in order to do that, you need the right protection for your staff. Have you been able to put that into place? Were you given enough preparation time?
So initially the guidance was don't stockpile, but we weren't given any guidance about what PPE we're going to be requiring. So normally within our homes we'll have gloves and aprons, but it would be unusual for us to have masks within our care home.
And did you manage to get hold of that equipment?
Eventually, yes, but in the beginning it was a real uphill battle to try and find masks, and also specialist masks for when we're delivering care relating to aerosol generating procedures such as suctioning. We needed special fitted masks, and we still can't access those.
And the reason why you can't access them, is that because there are reports from other care homes that they're told that suppliers are prioritising the NHS over the care sector and therefore the supplies aren't available. Is that a problem that you've come across?
Definitely. First that I knew about this was 2 weeks into March, when we were putting in an order for just our normal cleaning products, and we were told, we don't know whether we're going to be able to supply you. We've been told to redirect to the NHS frontline. So that was the first we'd heard about it, second week in March. Since then, trying to access certain PPE has been really difficult. And again, we're being told NHS frontline staff are the priority.
You see, OK, let's bring in Laura Hibbard now. So, Laura, I was reading your diaries in the Mail. They made absolutely harrowing reading about what it's been like. And I just see no difference, frankly, between the NHS frontline in hospitals and what you guys have had to be doing in care homes. You've been just as big a part, as many people appear to have now died in care homes from this virus as in hospitals. So you are, to me, exactly the same in terms of frontline, and yet you've had very little of the protective equipment. What has it been like for you? How scared have you felt about your own safety? And how have you felt about so many people that you're seeing in care homes dying from this virus?
It's been absolutely awful. It has been the worst time in my career, my 16-year career. We're not used to losing so many people in such a short space of time. Obviously, we have a great deal of care for our residents here, and to lose a resident, it is harrowing. It's a horrific time. You know, fearful, absolutely. We are all very, very fearful. We have got kind of used to being in this environment now, but it is very scary. It's very scary when we see how many other health professionals are dying because of this virus.
We know now that over 250 people working in the NHS and care sector have died. I mean, I can't even imagine what that does to people like you who have to go in every day to fight this virus, knowing that that's been the death toll of your colleagues.
Absolutely, and all my colleagues and speaking to colleagues across Sheffield, we are all very fearful, but we're here to do our job that we all love dearly.
We know that from the excess deaths figures, which are being published now by the ONS, that there have been an estimated 61,000, I think, excess deaths in this period. Many, we don't know what the reality was about why people died for various reasons. Some GPs not being able to come and see people before they died and so on. Lots of factors. But from your feeling at the sharp end of this, do you think most of the excess deaths are coming from the virus causing a death, even if it's underlying conditions?
Absolutely. I think, you know, absolutely. You can see within the care homes that we obviously do have several people with the COVID symptoms, and obviously, you know, you can see that when we've got people within the care homes with those symptoms and we have a higher rate of death, you know, it kind of goes hand in hand that is one of the causes of that death, unfortunately.